My name is Dr. Shereef Elmoamly. I'm a consultant hematologist at the Russell's Hall Hospital at West Midlands region, and I provide clinical service at the Nuffield Health Warwick Hospital, as well as the Sutton Med Consulting Centre at Sutton Coldfield. I've chosen to specialize in hematology, and I'm working as a hematologist for more than 20 years now, as it includes a variety of disorders which are sometimes interestingly challenging in diagnosis, but also it's always really rewarding to see my patients improving in front of my eyes after a variable period of not being well. Hematology is a very rich field for research, and there's always new treatment lines emerging, and the pace of development of these medications, these lines of treatment, is really accelerating. For example, disorders 10 years ago, which were really difficult to treat with the need of hospital admission, can be managed in the outline setting with some oral medication, and that's really interesting to see. Hematology field and my practice and my profession is really rewarding when I see my patients return back to their usual activity like work, sports, gym, and it's really nice and interesting to see, for example, patients with blood cancer after a variable period of treatment ring the bell as a sign of complete cure and carry on with their life as they used to be. It's really nice to see. Hematology field is really challenging as well. As a hematologist, I need to keep up to date all the time to be aware of the recent advances in research and treatment. For this, I'm regularly attending both national and international conferences like the British Society of Haematology, European Haematology Association meetings, as well as the American Society of Haematology. I attend and present as well in those, and I share in the development of the national UK guidelines for the hematology UK doctors to follow. And I'm involved as a principal investigator in many clinical trials in my center. In my profession as a hematologist, I always provide care for my patient, and it's always my priority to provide holistic approach, not only including the medication or drugs, but also psychological and mental support, dietary support, and physical support as needed. My approach to the patient is not restricted to the hematological problem, but to them as a whole body and human being who needs care. Respect to my patient's values, views, and priorities is always a priority in my profession, and I try always to tailor my management plan according to my patient's priorities and values, regardless to whether that might not be the most recent advances, but patient's value and priorities are always important. Keeping up to date with my management plans is always my priority in managing patient, and always trying to provide the most recent treatment plans and involvement in clinical trials as needed to provide medication and care which provides the least hassle and side effects with the best efficacy to make the patient return back to their normal well-being.